Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Janine Cook-Garrard from the nursing department here at Nassau Community College. And today we're going to talk about psychopharmacology and psychotherapy. My guest today is Kira Sposato, a New York licensed state nurse practitioner with over 20 years of experience in private practice, providing both psychopharmacology and psychotherapy. Kira, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you very much.
First of all, I hope you're doing okay in light of this pandemic. Has it really affected you or your family members?
Actually, it affected me in a positive way. I was able to change my practice around. I've been doing much more Zoom calls and phone calls. So I've been able to live in Florida part-time now and work remotely. So for me, it's been a very positive change.
So a nurse practitioner, huh?
Yes.
Person after my own heart. I also am. So tell me about yourself and your career path.
I started out as an RN working in addiction and a inner city drug rehab. And I enjoyed working with the addicts so much. And I also worked during the time of the AIDS epidemic in '85, right around the time Rock Hudson died. I came into nursing, which was a very intense time. I'm really dating myself here, but all of that made me love talking to patients almost more than treating them, even though we were treating so many for AIDS at that time. And then I just went on to Stony Brook and got my NP in 1995. And now I've been in private practice, which was the best thing. Anybody who's on RN, I would encourage to go for your NP because you're just so independent. You know, You're working like a physician. You're ordering blood tests, you're doing therapy, you're prescribing medication. It's wonderful. And I think we listen better than psychiatrists. So I think the world needs more of us.
I agree. So tell me, the words psychotherapy and psychopharmacology, could you define those and tell us what they mean?
Yes, psychopharmacology is the use of psychiatric medication to treat, I'll say mental illness, but really mental health issues. So psychotherapy is the use of talking and some other kinds of skills, cognitive behavioral skills, to get to the root of the problem. But I was a psychotherapist for many years before I became a prescriber. And what I noticed was that many people who are coming to see me for anxiety or severe depression were not getting better through talk therapy. It was taking them a long, long time to get to the root of the problem. And sometimes even if you got to the root of the problem, you didn't feel better. And once I started prescribing, these same patients who were my clients now were better. Their anxiety diminished or disappeared with the use of medication. So they are actually able to do therapy now when they couldn't before because they weren't motivated or they were just too pessimistic. And people with anxiety no longer have panic attacks. So they could also do the work of therapy and talking because what they talked about wasn't throwing them into a panic. So the combination of both, I always say that medication, psychiatric medication, gets you out of the darkness, the black hole, and therapy pushes you forward. So the combination is so powerful, and it really works.
What types of patients do you treat? Tell me about your demographic.
Demographic, I treat adult patients only. So my demographic is 21-year-olds to about 75-year-olds. And since COVID, I've had more 21 to 27-year-olds than I've ever had in my practice before.
What do you think that's from?
I know what it's from. And it's something, I don't have children. I didn't want children, but my sister and my peers, I think, are a bit guilty of. Because these kids in their 20s, because they were so protected by their parents who meant well, my friends meant well, they have no coping skills. They were rescued every time there was an issue. I have parents who help their kids talk to their boyfriends and girlfriends during a breakup. The helicopter moms and all that. These kids are now dealing with this pandemic with zero coping skills because everything was taken care of for them, and they don't know what to do. So they're coming in with anxiety. I mean, that's not even depression. They're coming in, all of them, with so much anxiety because they don't know how to cope with remote learning. They don't know how to cope with their lives being disrupted. They don't know how to deal with anxiety. And, it's actually very upsetting to me that, I am there teaching them coping skills. And really, they should have learned a lot of these skills when they were younger and had to face some adversity, which they never did. And so here we are, a pandemic is testing them, and they are a mess.
Talk to me about coping skills. When you say coping skills, what does that include? I know dealing with maybe devastation or a pandemic may test your ability to adapt, but what coping skills do you find lacking?
One, I was shocked yesterday. I was talking to a woman. She was probably 27, and she was extremely anxious, came to me for anxiety. And I said to her, do you ever use self-talk? And she didn't know what that was. And I said, do you ever just tell yourself it's going to be okay? Calm down. You'll be all right. And she said she never heard of that. And I was really surprised because really we learned that very young, like to tell ourselves, okay, calm down. The little voice inside us, chill. You're going to be okay. Like that self-soothing is such an important coping skill. And I find these kids are not able to self-soothe. Just say you're going to be okay. You've gotten through this before, or you're capable. A lot of these kids don't think they're capable, and yet they're so smart, and they're actually pretty accomplished too because of technology. They're so good at it. So being capable and just knowing you're going to be okay, and also having faith. And I don't mean religious faith. I mean faith in yourself, the people around you, that you will be able to get through this. And if something happens, let's say you do get ill or a family member gets ill, that you will deal with it. You will be able to find a solution or tackle the problem. They don't realize that they even have that kind of strength, which still is so surprising to me because a lot of them are successful professionally. And yet when it comes to their personal lives, they are powerless almost.
Do you attribute some of the decreased ability to cope connected to more of communication nowadays being internet and not face-to-face communication, where you have the socialization really person to person versus computer to person?
I certainly do. So I haven't started. What is that? What's the latest Gen
X, Z
coming up? They've been raped on computers. So far, I haven't seen that group just yet. These kids didn't grow up on computers, but certainly they were using computers early on. Well, that's a whole other issue with coping, because another issue, not just COVID related, the anxiety is also much more increased for that younger group because of social media, because of not feeling good enough or pretty enough. I mean, it's a whole other issue that they can't cope with, because on social media, you really don't want to tell others, because you're usually pretty public, that you're feeling fat or ugly. I mean, they can't share that online because then number one, can explode. And number two, someone else is bound to see it if it's on a post. So they're tackling this by themselves, and they come in to see me. And again, these are really accomplished, beautiful, attractive, athletic people, women and men, and they have no self-esteem, and they are very attractive, in shape. It's stunning, and they tell me it is because of social media. They say it themselves, and they tell me to stop going on social media, to stop comparing themselves. And you can only go so long, but then you feel isolated if you're not on social media. So it's very, very hard for them. And they're asking me what they should do. I think they should be asking, other adults in their lives, their parents, like, how do I navigate this if it's harming me?
So how do you start with someone that comes in with a depressive disorder or an issue that is psychiatric in nature, do you start with a non-pharmacological approach, no medicine, and go through the therapy, or do you do the medicine first and then the therapy? What is the
Well, for my practice specifically, because I've been in practice for so long, I'm not doing the 45-minute, hour-long psychotherapy sessions anymore. I'm doing more medication management, but which is 30 minutes, but I do psychotherapy in those sessions as well, but they're 30 minutes. So people being referred to me are really coming for medication management. So a lot of them have been in therapy, are in therapy, and as I said at the beginning, they're not responding. So they are ready to try medication. So for them, unless I think their symptoms aren't really interfering in their ability to function, I start with medication. And then, like I said, I lift them up because they're coming to me pretty impaired if they want medication. And so I lift them up, and either their therapist pushes them forward, or then I start working with them to push them forward.
They come to you for the medication. How do they know that they actually need medication?
Some of them are referred by their therapist because, again, they're stuck and they're not improving. And others are so scared because, well, I'm going to use the younger people coming in. They are so anxious. They've never experienced this kind of anxiety. They're scared. And their friends tell them they're on medication. Certainly, some people are over-medicated. Medication is prescribed very easily and very readily. So many people are on meds. So for them, it's probably social media, actually. They talk amongst themselves. They say, this helped me. Everyone knows about Lexapro now. Back in years ago, no one knew. Maybe people knew what Prozac was. No one even knew what other medications were. So these kids are and these adults too, are pretty familiar with medication through probably social media. So they know what they need or what they want. They're usually right, actually.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Janine Cook-Garrard, and today we're learning about psychopharmacology and psychotherapy with Carol Sposato, a New York State licensed nurse practitioner with over 20 years of experience in private practice, providing both psychopharmacology and psychotherapy. So, Kira, we have another question. I hear that you react very strongly to the saying, choose to be happy. What does that mean to you?
This is a complaint. So the younger people are very anxious during COVID. The older people are more depressed. But I've been seeing people, before COVID, but the ones who come in for depression, especially women who come in for depression, a lot of them say to me, I don't know why I'm so depressed. I have everything in my life that I could have dreamed for. I'm healthy. My marriage is good. My kids are good. And they feel so guilty about being depressed, and which is actually causing more symptoms of depression. And in those cases, these patients of mine are clinically depressed. They're not just not choosing to be happy, which, people just are telling them, come on, snap out of it. Just, you got to just decide, wake up and decide you're going to be happy today, or look at the positive, or what's wrong with you, snap out of it. This is what they're being told. And they come and see me, and they are actually exhibiting clinical symptoms of depression, which are, I'm just going to mention a couple, anhedonia, which is a lack of enjoyment and pleasure in things that used to give you pleasure. That's a clinical symptom of depression. It's not sadness. Sadness is an emotion. I always say depression is a disorder. So sadness you can experience every day. You can snap out of sadness. Maybe it'll take a couple of days. You can snap out of sadness. But when you go into depression, it's much more difficult because of these vegetative symptoms we call physical symptoms, such as anhedonia, such as hopelessness. You just see the world, like I said, you're in that dark hole. Everything seems dark. And when everything seems so dark, it's very hard to motivate yourself to get out of it. It's also very hard to motivate yourself to exercise. When you're that dark, sometimes you experience something called psychomotor retardation, which is a slowing down of all of your movements. So even getting into the shower can take so much time because you're walking very slowly. You're lathering up very slowly. That's another symptom of depression, clinical depression. I mean, I could go on. There's a list of things, but those things are the crossover into mental illness. And I hate calling depression a mental illness because there's such a stigma around mental illness, but a true clinical depression is a mental illness that can be treated.
I also saw that laziness, that you claim it to be not a symptom. Is that a symptom of depression, or how would you characterize laziness?
That's a really great question. Again, I treat adults only. So these adult patients come in and they tell me their complaint is, I'm very lazy. And I'll say, well, what does that mean? And they will say either, I can't focus, I can't get things done, I can't advance in my career. And they think that they're coming in to be treated for laziness. And like you just said, laziness is never the problem. It is a symptom. And actually, it's probably the number one symptom of adult attention deficit disorder, which is probably an entire other topic. So once these people who have felt like failures their entire lives because they've been called lazy realize, oh my gosh, maybe there is something else wrong that's causing the laziness. I'm not just flat out lazy, a loser, or however they're feeling by the time they get to me. It gives them so much hope. And laziness is a symptom. It's a symptom of many things, but it is not the problem. And that's important for people to realize so they feel better about themselves too and are more hopeful.
So what are the common psychiatric medications available now that you prescribe?
Well, for depression and anxiety, the SSRIs, which are serotonin reuptake inhibitors, are still number one choice because they have the least amount of side effects. And people are very worried about side effects when they come in for medication. So the two top side effects, I guess you can have, not that you will have, but you can have, are weight gain. And it's really important. I tell my patients, you do not wake up overnight 25 pounds heavier. If you're going to experience weight gain, it might be a pound a week, a couple of pounds every 2 weeks. So you're not going to be out of control with your weight gain. If I see you're gaining weight, I will change your medication so that you don't gain weight. And the other side effect is libido. So your libido is somewhat diminished. Women especially have a hard time having an orgasm. Men can take a longer time to climax, which is not really that much of an issue for them because women, enjoy maybe longer. So those are the issues, but we can work on those. We can treat those. So those are the SSRIs. Let me just list them quickly. Prozac is the first, and then there's Prozac, Zoloft, Lexapro, Luvox, and Paxil. Paxil's not used that often anymore. It's too sedating. And then you have a whole host of newer medications that came out to treat both depression and anxiety, and they just work on other neurochemicals.
So are psychiatric medications, are they addictive?
Yeah, that's a big concern to people. So addictive, I don't know. I don't think people understand what addictive means. So emotionally, there's emotionally addictive and there's physically addictive. So some of the SSRIs can be physically addictive to some people, but all that means is we just taper off of them very slowly. So the common withdrawal effect of some of these medications is a little more anxiousness. Some people have zapping in their heads and arms, which is probably the worst of it. So you just need to come off slowly. So are they addictive? You don't want to just stop psychiatric medications cold turkey like that. It is a bit jarring to the brain. So in that regard, you should come down slowly so you don't feel uncomfortable physically. And yes, some of the benzos to treat anxiety, Xanax, Klonopin, Ativan, those can be physically addictive. In time, I tell all my patients, at high doses several times a day. You don't become addicted to Xanax at 1/4 milligram, which is what I prescribe. I mean, you just don't get addicted on such a low dose. At high doses, people with panic attacks who cannot function because they have panic attacks every few hours, those people are on much higher doses, usually 3-4 times a day. those people are probably going to have a very difficult time coming off of a Xanax or Klonopin. Yes, those people, you can't just taper them off because they can have a seizure if they've been on it a very long time. So, it really depends on the class of medication you're dealing with.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Janine Cook-Garrard, and today we're learning about psychopharmacology and psychotherapy with Kira Sposato, a New York State licensed nurse practitioner with over 20 years of experience in private practice, providing both psychopharmacology and psychotherapy. So, Kira, do you stay on psychiatric medications for the rest of your life, or is it very acute?
That also depends on your history. So mental illness, like a real clinical depression, panic disorder, bipolar disorder, schizophrenia, those are usually hereditary. And you can see it when you do the family history. Someone in the family had schizophrenia. Someone in the family was in a psychiatric hospital dating back. So if you've inherited a mental illness, a serious one, and the serious ones, again, do not have to be depression. They're bipolar, schizophrenia, and some major depressions, you will probably have to stay on medication for the rest of your life. Again, if you inherited a psychiatric disorder. But if you've had some sort of trauma that changed your brain chemistry, and which is environmental, and you're coming in because something very upsetting happened, usually only need to stay on meds for about 9 to 12 months to reset your brain to how it was prior to the trauma.
So do you ever prescribe herbals as a part of the medication protocol?
Because herbals are not FDA approved, I, as a licensed clinician, am really not allowed to recommend herbals. Even though I recommend melatonin and a couple of other medications. But if something goes wrong with an herbal that was not FDA approved, that I basically prescribed or recommended, however you want to say it, that's kind of on me. And if anything, God forbid, happened and I was involved in some kind of lawsuit and I recommended something that was not approved, I wouldn't have a leg to stand on. I'd be wrong. I'm very careful with that.
So you talked about mental illnesses as being inherited is familial. What is there a probability for the child getting a mental illness when the parents have had it, or does it depend?
It actually does depend, which is I think, comforting. So for the people who grow up in a very, very stable environment with very little trauma, again, trauma being divorce, a lot of arguing, addiction in the family, sometimes that gene for their mental illness does not turn on, which is wonderful. And it's not just, drugs can turn on the gene to mental illness. Anything that's stressful to the body can turn that gene on. But for some people, if they can just avoid things like using drugs, experimenting with drugs, they may be able to get through without having a severe mental illness. If you've inherited and you have that gene and you're also experiencing a lot of stress in your life, especially growing up, that gene usually turns on between 18 and 21. That's when we see all these illnesses starting up full force.
So you don't really see pediatric psychiatric illnesses, more adult psychiatric illnesses? I
don't treat pediatric, but when I was doing my residency, my clinical training, I did work with peds. And yes, in some of those, it was very difficult to diagnose what the issue was with the peds, though, which is why I'm not comfortable working with them really, because they're exhibiting maybe violent behavior, aggression, opposition. So with peds, you're not sure, are they going to develop bipolar disorder? Is this a depression? Is this ADD? It really depends, again, on their environment. What kind of family life are they experiencing? So that peds is much more complicated.
I have a list of mental illnesses: depressive disorder, bipolar, anxiety, panic disorder, adult attention deficit disorders, obsessive compulsive disorders, post-traumatic stress disorders. Oh my goodness. And the list goes on and on. What do you see mostly? There's so many different psychiatric disorders that we can talk about. What do you see and what do you think is most predominant?
Well, again, what I see, I guess I have a bit of a reputation out there for treating bipolar,
Okay.
which is also overdiagnosed right now. But I think, I'm glad people are more aware of what bipolar disorder is.
What does that look like?
That looks like, well, there are two variations. So mood swings. But again, people come in and they immediately say I'm bipolar. I mean, the mood swings mania, it's called, or hypomania. They have 6 different criteria that you need to be present to be diagnosed as manic. So they're having mood swings, but the mood swings are severe enough. Again, it's always to interfere in your ability to function. That's why people come in for meds, because they're not functioning well. So for me, I see that a lot. And also it's really important because when patients see their primary and are put on medication, if they have an underlying bipolar disorder, 2 things can happen. One is they will become more depressed on an antidepressant, which is really scary. And that's where the suicide can happen too. They say adolescents, be careful with suicide because they actually become more depressed and they're impulsive to begin with. So they're at greater risk for suicide. So if they become more depressed, that's an issue. And the primary seems to just switch their medication to another antidepressant and another antidepressant. So when they come to me, they've tried almost every medication. And the problem is that they're actually bipolar and they need a mood stabilizer. Or if they become manic, they're highly impulsive. And if you're on an antidepressant, you can very easily become manic as well because it pushes you up. So the reason you become depressed is usually because it pushes you up a bit and then you fall back down and go in deeper. So these people come in and, the usual, the spending sprees, sex sprees, drug sprees, eating sprees. And a lot of those are caused by an antidepressant, which, is what scares people many times about taking medication because they hear, can I get worse? Can I get worse? And I'll say, yes, if you're misdiagnosed, yes, you can get worse.
So if you had to leave the audience with one thing that you want to leave us with, what would you say?
Have faith in yourself and your abilities. Have faith. Because if adults especially, if you've gone through this far in your lifetime, you are able to cope. I always say to patients, history shows that you've gone through whatever it is and you're still here and you're doing well, you're not on the street. So look at history. History shows you will survive and you could thrive. And the same with this pandemic. It's scary. It's turned lives upside down, but you've managed to get through. Again, more adults, because these young people don't have the coping skills. You've managed to deal with a lot of things in your life. You will deal with this as well. And so have faith in yourself.
Thank you for being here, Kira Sposato, a New York State licensed nurse practitioner with over 20 years of experience in private practice, providing both psychopharmacology and psychotherapy. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you very much.
This is Dr. Janine Cookerrod from the nursing department here at Nassau Community College. We want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.